Hello everyone, this presentation is to introduce failure mode and effects analysis in healthcare. Abbreviation is FMEA. What is failure mode and effects analysis? Healthcare is an exceedingly complicated system where accidents, errors, close calls, also known as near misses, Sentinel events, failures, and adverse events happen. In addition, healthcare processes exist throughout healthcare organizations. They are increasingly independent and are often interlocked or tightly coupled. Inconsistency of variable input, time constraints, hierarchical culture, and the dependence on human intervention increase the risk of failure in system processes throughout an organization. Failure mode and effect analysis is one technique for systems improvement that can enhance safety. FMEA is a team-based, systematic, proactive, and reason-based technique that is used to prevent the process and product problems before they occur. It provides a look not only at what problems could occur, but also at how severe the effects of the problems could be. FMEA assumes that no matter how knowledgeable or careful people are, failures will occur in some situations and could even be likely to occur. The focus is on what could allow the failure to occur. Ideally, FMEA can be used to help prevent failures from occurring. However, if a particular failure cannot be prevented, FMEA then focuses on protections that can be put in place to prevent a failure from reaching the individual receiving care, treatment, or services, or in the worst case, mitigate its effects if a failure can cause harm. FMEA can improve the safety for individuals receiving care by helping to identify failures and close calls, and by protecting individuals from harm or mitigating harm when, despite an organization's best efforts, failures do occur. It can narrow or eliminate gaps in quality and performance that yield improved outcomes. It is easy to learn and enhances organization-wide collaboration and understanding. In short, its use is good business practice. As with any other tool, the more you use FMEA, the more familiar and comfortable it becomes. This is FMEA keyword definition. Failure when a system or part of a system performs in a way that is not intended or desirable. Mode, the way or manner in which something such as a failure can happen. Failure mode is the manner in which something can fail. Facts, the results or consequence of a failure mode. Analysis, the detailed examination of the elements or structure of a process. FMEA 8 key steps. The first is select a high-risk process and assemble a team. Second, diagram the process. Third, brainstorm potential failure modes and determine their effects. Fourth, prioritize failure modes. Fifth, identify root causes of failure modes. Sixth, redesign the process. Seventh, analyze and test the new process. Eighth, implement and monitor the redesigned process. Step 1, select a high-risk process and assemble a team. Characteristics of a high-risk process: variable input, complexity, lack of standardization, tightly and loosely coupled processes, dependence on human factors, tight and loose time constraints. Variable input in the healthcare arena, individuals who require care and services are the principal inputs to a process. Individuals' variability is high. They may be very sick, have comorbidity, be receiving other treatments, or have differing care preferences. In addition, the staff caring for individuals might be highly variable in terms of skill level and approach to the task. The healthcare process, therefore, must accommodate the inevitable and uncontrollable variability of their principal inputs. Complexity: healthcare processes tended to highly complex with dozens of steps, which means they are particularly prone to failure. The greater the number of steps, the hang of all step linkages, the greater the probability that something will go wrong due to the interdependence of the parts and the whole. A lack of standardization diminishes the likelihood that the process will be performed as desired. Individuals performed the process must carry out the steps in a constant manner because healthcare inputs the individuals being served are so variable and need to be accommodated. It is very difficult to achieve process consistency. Practice parameters, protocols, and clinical pathways all aim to reduce variation in how individuals perform the tasks in the process. Organizations can look both internally and externally for ideas on what specific process need attention and study using FMEA. Internal sources, performance improvement data. This data can come from a variety of sources, including risk management, utilization management, and quality control activities, as well as from infection prevention and control surveillance and reporting. Performance improvement data can help identify high-risk processes. Research data and morbidity and mortality data can also be used. Using comparisons conducted internal over time with similar processes in other organizations, always external sources of information can help determine whether excessive variability and unacceptable levels of performance exist in processes and outcomes. Individuals are receiving care and staff feedback. Staff in particular will be very aware of processes that are tedious or error-prone or that continuously work around because of better design. Encouraging staff to come forward and discuss problem process can help identify some serious problem area of which leadership is unaware. Sources for staff and the individual receiving care feedback may include surveys, focus groups, and leadership workaround. Reporting systems, developing a voluntary reporting system in which staff report errors, near misses, or process that generally did not go according to plan can allow an organization to collect data on the potential problematic issues that are occurring. For such a reporting system to be effective, staff must feel comfortable reporting and it must be easy to do, allowing staff to report via questionnaire, voicemail, email, or other simple to use format can help encourage staff to report issues. External sources, the Joint Commission's Sentinel event database, all types of healthcare organizations can experience Sentinel events, including behavioral health facilities, long-term care facilities, home care organizations, ambulatory care organizations, and clinical laboratories, in addition to hospitals. The statistics represent data that have been collected from 2017 through 2020 Q2. The Joint Commission continually receives new data on Sentinel events. In drawing up a tentative list of team members, check to ensure that the team includes the following: individuals closest to the event or issues involved, individuals critical to implementation of potential changes, a leader who are broad knowledge based, who is respected and credible, someone who has decision-making authority, individuals with diverse knowledge base. Use of a checklist or form can be very helpful during the preliminary startup phases of FMEA. Relevant questions include the following: has the scope of the FMEA been clearly defined? Does the team know what its mission is? Is there a team member for each key department or discipline affected by the process being analyzed? Does the team include individuals who are critical to implementing potential changes? A leader with a broad knowledge base, individuals with decision-making authority, and individuals with diverse skills and knowledge. Has a team identified the required resources? Is a team aware of the expected time frame for completing the FMEA? Does the team know how its results should be communicated and to whom? Step 2, diagram the process. The next step in value mode and effects analysis FMEA is to review the process in full by describing or diagramming it in a graphically format. Multidisciplinary participation of FMEA team members and all others involved in the process is vital to the identification of each and every step of the process, which may be more complex than previously below. Each team member must thoroughly understand the process and its component sub-process as applicable. Team members should also understand the interrelationships between the selected process and other care processes. FMEA teams might want to draw on various individuals who have expertise related to selected steps or processes. Flowchart or process maps are perhaps the most commonly used tool for helping teams understand the steps in a process. One of the oldest quality improvement tools of Flowchart is a graphic representation of the path a process follows or should follow from start to finish. A flowchart can depict the sequence of the steps as designed and as actually performed. These often are not the same. The team might want to create two separate flowcharts, one that outlines how the process is intended to occur as defined by policies and procedures, and one that follows the process as it usually occurs in normal circumstances. By comparing the two charts, the team can more easily identify redundancies, inefficiencies, misunderstandings, waiting loops, and decision points, all of which can create process failures. During the process design or redesign stage, a flowchart can also be used to show the desired path the new or redesigned process is to follow. Steps for creating a flowchart. Teams can approach the creation of a flowchart in a number of different ways. The following are 5 possible steps that teams can follow. Establish starting and ending points of the process. This will help the team contain the chart within manageable boundaries. The team may decide how to change the boundaries later if the process proves to be 2 or 3 processes in one, for example. Brainstorming activities and decision points in the process. Brainstorming should be done by those most familiar with the various steps in the process, usually the direct caregivers, with assistance as necessary from people outside the team. At this stage, the team is looking for specific activities and the decision necessary to keep the process moving to its conclusion. When considering how the process actually is performed, teams should consider caregiver to caregiver, unit to unit, and shift to shift variations. Determine the sequence of activities and decisions. Once the activities and the decision points are gathered, the team must determine their sequence. This is often not as easy as it sounds. Some activities may appear to occur simultaneously, while others may seem disconnected, or certain decisions may cause steps to be repeated. However, these flows in the process must be included in the flowchart. Use the information to create the flowchart. If creating a traditional flowchart, the team should place each activity in the box and place each decision point in a diamond. Connect this with lines and arrows to indicate the flow of the process. Some teams find it helpful to number each step consecutively, 1, 2, 3, and so on, and to do likewise with all substeps 1A, 1B, and so on. Analyze a flow chart. The team needs to look for unnecessary steps, redundancy, barriers, and any other difficulties. Team members may notice these issues during the creation of the flowchart, but they should not be discussed in detail until this point. The team may also want to find spots where the process works well and consider these as models for improvement. Step 3. Brainstorm potential failure modes and determine their effects. Brainstorming is a structured and creative process that a group of people use to generate as many ideas as possible in a minimal amount of time. Brainstorming stimulates creativity and encourages many perspectives on an issue. If properly conducted, brainstorming provides a safe environment for team members to express ideas, and it can strengthen the team as a whole. Effective brainstorming can be accomplished in the following 5 basic steps. 1. Define the subject of the brainstorming section. This ensures that the section will have direction and that ideas will not be too dispersed to be useful. Make sure that everyone understands the focus before ideas start flowing. Limit brainstorming to one level or process step at a time. Think briefly about an issue. Allow enough time for team members to gather their thoughts, but not enough time for detailed analysis. Do not give the team time to second-guess their ideas. Be aware that self-censorship will stifle creative flow. 3. Set a time limit. There should be enough time for every member to make a contribution, but keep it short to prevent premature analysis of ideas. A time limit of 10 to 20 minutes for gathering a list of potential failure modes with each step and handoff may be appropriate and effective. 4. Generate ideas. A team can use a structured format in which the members express ideas by taking turns in a predetermined order. The process continues a rotation until either time runs out or ideas are exhausted, or an unstructured format in which group members voice ideas as they come to mind. Clarify idea. The goal is to make sure that all ideas are recorded accurately and are understood by the group, not judged or analyzed. Clarification takes place only after everyone is out of idea. Do not attempt to remove duplication. Put the idea in sequence or rank them at this point. When brainstorming is through, the team should have a varied list, not a defined list. When brainstorming failure modes, teams can consider the following elements: people, for example, staffing level, training, scheduling, communication, or competence assessment issues. Materials, for example, issues related to availability of supplies or misplaced supplies. Equipment, for example, issues related to availability of appropriate equipment, measures, for example, issues related to the processes and the procedures that staff use. Environment, for example, issues related to the safety of the environment, such as infection prevention and control or hazardous waste. FMEA worksheet. The team's use of a worksheet that tracks the progress of an FMEA is highly recommended at this point. A worksheet documents process steps, failure modes and effects, and subsequent steps to rate their quality, determine their possible causes, and identify and implement redesign recommendations. It provides an easy reference or summary of a team's progress to that and helps the team stay on track with the next FMEA steps. Teams can create their own worksheet or adapt one used by other organizations. Whether or not the team creates its own worksheet or adapts one, the team might want to consider the following points. Consider and identify possible FMEA worksheet column headers. This could include the following: steps in process or links between steps, potential failure modes, potential effects, probability of occurrence of failure modes, detectability of failure modes, probability of occurrence of effects, severity of effects, a risk priority number of critically index, root causes of failure modes, redesign recommendations, persons responsible for actions, target completion date for test, new process implementation date and actions, monitoring mechanism and frequency. Determine the worksheet scope by selecting column headers. Fill in the worksheet as the team progresses. Make sure to use concise wording. Lengthy sentences will decrease the usefulness of the worksheet as an at a glance look at team progress. Use boldface type to highlight key information such as risk priority numbers, critically indexes, and completion dates.